Hey guys, once again, thanks for being here. I'm going to be doing, this is part 2 now of my series. It's a 3-part series, top 6 most common injuries in the nursing profession. Today I'm going to be talking about how to avoid them. Being aware with that first video I did is key, but injuries do happen, and this is some tips that I have just to avoid injuries at work. For those of you guys that don't know me, my name is Jason Rozinka. I've been a nurse for the past 20 plus years, all with direct patient care. So I've seen injuries. I've seen my coworkers that have had career-ending injuries, and it happens. It's there. We want to be as safe as we can, and these are a few tips I have for you. So I'm going to kind of go through my list here. Number 1 I talked about was musculoskeletal, wrist, back, ankle, shoulder. You have it, whatever kind of injuries that we have that are related with musculoskeletal. A lot of injury happens when we work too much and we get tired and we get sloppy, and we're not using proper body mechanics. So don't work so much. Life isn't worth it just to make a few extra bucks to have a career-ending injury. So use those proper body mechanics. Delegate. There's certain things that we do as nurses that we don't need to. They can be delegated to somebody else. Ask for help. You can never have too many people lifting a patient or moving a patient. So the more, the better. If you do get injured, report that injury. That's something that we need to do so we're covered. If there's going to be any workman's comp or anything like that, it needs to be reported right when you do it. Wear good shoes. It's not about how your shoes look, it's about how they function for you. You need to wear good, comfortable shoes that are going to support you for a full day of work so you don't get injured. Be healthy. You need to be in shape. If you're not in shape, you are at more risk for injury. If you're getting sore at work, you're at more risk for hurting yourself. So yeah, workout, core strength is huge. A lot of people focus on just their legs and their back, but if you're using that front core, that is huge on saving your back, especially at work. If you're in a situation where there's a violent patient, call security. Don't be a hero and try to jump in and get yourself injured, hit, whatever. That's where broken bones happen. That's where sprained wrists happen with patients grabbing you. Number 2 I have is needle sticks and sharps. Needle sticks and sharps are, like I said before, less common because of some safety devices, but especially in procedural areas, they're there. Act like every patient has a communicable disease. You don't, when you've got someone that does have it, you don't treat them any different than anybody else. Treat like everybody does, especially when you're working with needles and sharps. Use those safety devices. The safety devices are there for a reason, and they've come a long way with those, so don't recap your needles. Use the safety devices that they have. Hopefully they have them in your facility. If you have an open wound or anything on your hands, keep them covered. I used Dermabond, or if you use some benzoin, some opsites, just to keep that covered when you're washing your hands a lot. It's hard to keep band-aids on and they're not overly clean. So that's what I use. It works for me. Try that out. Otherwise, number 3, I've got hazardous drugs and hazardous chemical exposure. This is something that you just need to be aware of. If it's something new that you don't know what it is, look it up. You should have a manual at work, or you've got pharmacy, or anybody else that uses those chemicals on a daily basis should know the hazards. And don't, if you don't know, ask questions, because that could harm you and you don't even know it. So be aware of the risks. That's number 1. Number 4 on my list, I've got radiation that we talked about. And this is a lot for people that work around radiation. You're going to be wearing, if you're in direct contact, you're going to be wearing lead apron and vest. You're going to be wearing a thyroid shield. You're going to be wearing glasses. If you are not aware, if you're at risk when they're taking x-rays or whatever they're doing, if you're down on CAT scan, ask. Ask the technicians. They know a lot about radiation and radiation exposure. Number 5 is infectious disease. This is another thing that we're talking about. Just treat everybody that they have a communicable disease. If you don't know, you're better safe than sorry. Follow your hospital's policy and procedure if somebody is in isolation, and what you should be wearing. If it's a glove, it's a mask, it's an N95 mask, any of that stuff. So yeah, just treat all your patients like they have a communicable disease, especially if they're being treated or if they're being tested for it and it's not there yet. So that's what I got, guys. That's my 5 here that are going to help you out. Hopefully this will keep you free from injury and your career injury free, so you can be in the nursing profession for a long, long time. All right, guys. hopefully this helped out. Check out tomorrow. I'm going to have my part 3 of the series, and I'm going to just be talking about what you do if you do get injured at work. All right, guys, if you guys like this video, like, comment, share, and I'll see you next time. All right, remember to play hard and eat well, guys.